The World Health Organization warns that we could reach a stage where we have organisms resistant to all antibiotics because of the superbug crisis, a post-antibiotic era. This means commonplace ailments could suddenly become dangerous, perhaps impossible to treat because of bacterial resistance to the available antibiotics.
Animals under treatment, in an ideal situation, and if we were good people, should not be used for food. The milk coming from that animal, the meat coming from that animal, the eggs coming from that animal should not be consumed by human population until the withdrawal period is over. Unfortunately, we are Kenyans. So we pump this food into the food chain. And so it ends up that because of a poor environment, the animal gets sick, we then end up with antibiotics in the food chain, which then ends up on our plate. But fundamentally of interest, and that's one of the things we are discovering, is the fact that farmers have also discovered, because my production system is not hygienically clean, it is having challenges with ventilation. So what they've discovered is you can use antibiotics at small doses to suppress that disease. And then that's the second way antibiotics are introduced into the system. So what does that antibiotic does? It suppresses the disease-causing organisms, and essentially what then happens is that it selects for resistance in the bacterial population. That resistance, when it's on a food, it ends up on the table, it does two things to you. One, the bacteria itself, because it's resistant, can cause an infection in human population, which ultimately cannot be treated. But two, the other thing that can happen, according to science, is that that bacteria with a resistant gene, when it comes, you consume that food, can pass the resistant gene to the normal bacteria that you have, which then again cannot be treated. And that's basically the driving force around superbugs in the production system.
Certain concerns may arise owing to the fact that more than 70% of all antibiotics from pharmaceutical companies worldwide are meant for livestock use.
Because of rise of superbugs, and I've said superbugs are bacteria that cannot be treated by known drugs. Yeah? That rise of superbugs has led to a situation that globally we are losing 700,000 people per year dying because they get infected by a superbug that cannot be treated, and so ultimately there's no recourse. That's one. In fact, to go further, it is estimated that by 2050 we'll be losing 10 million people annually because of superbugs. And that's why we are raising the flag now and saying, hang on, we need to change our perceptions and how we are managing production systems if we are going to stem the use of superbugs. Somebody would then ask, is it that serious? The reality is that 131,000 tons of antibiotics are used annually in farming systems. And shock to all of you, that is 75% of the whole production of antibiotics globally. So farming systems are consuming 75% of antibiotics globally. The other thing that we need to understand is the antibiotics that we're using on animals, the active ingredient is exactly the same active ingredient that we use in humans. So if there's a problem in the animal system because of misuse of those drugs for one reason or the other, it ends up on our table. And so even the big industry players, pharmaceutical industry players, are beginning to say, hang on, we cannot be doing research and producing molecules every 5, 10, 15 years, which then get resistance within 2, 3 years. So they are not even recovering their cost of research and development of some of these products. So they're already on board, and they're beginning to say antibiotics must be handled in a particular way. Antibiotics are prescription-only drugs, but in this country you can walk to an agrovet and buy a reserve drug. Those are some of the challenges. So that's one. Two, we are engaging governments and saying, look, it's about the human population. It's about human health. If in another 15 years we will not have drugs to treat our human population, we then need to have a conversation and start doing things certain differently. And they're not hard things. Industry, and I've worked for the poultry industry in this country, the people who can, because of proper hygiene, good genetics, good food, can produce without using antibiotics. And we are not saying that antibiotics shouldn't be used. We're just saying that antibiotics should be used correctly. If an animal falls sick, treat it, and treat it with the right antibiotics. If you go into the field right now, what is happening is farmers are self-medicating because antibiotics are readily available. Farmers have learned that, as I said earlier on, they've learned that if I, because of my poor hygiene or poor environment, if I put a bit of antibiotics in the system, then there's no problem. That's the discussion we're having. And I must say, currently, we have had very good response. We're engaging retailers like supermarkets to just have a discussion of how they look at their retail system so that they know food with antibiotics gets into that system. We are looking at having discussions with the big producers, chicken and pigs in this country and in this region, to see how we then drive narrative and change that narrative to work for us. So industry is actually beginning to come together because they are seeing this is a threat that we need to deal with. And it's better dealt with now, not 10 years, not 15 years down the line.
As a consumer, it is not always apparent why it is important to buy food that comes from a real farm versus food that comes from a factory farm. How then can we be certain that what we buy, despite being quality certified, will not interfere with our health negatively?
Our system has broken. Yeah? KEBS should be at the production level or at the slaughter process, taking certain samples. Because if you look at that packet, yeah, if you go to any supermarket now and look at any packet, it has a KEBS stamp. It has a Director of Veterinary Services stamp, which simply means that the product has been quality controlled. Yeah? But you and I know the reality is that it rarely happens. When your colleagues last year talked about red alert and also talked about white alert, they showed you that the system has broken.
How did we get here? Over the past several decades, there has been an economic and geographical shift in how and where food animals are raised. Large-scale factory farms raising one type of animal have replaced small or medium-scale farms that raise chicken, pigs, and beef cattle. Globally, the rise of factory farms has been driven by three factors: unchecked corporate power, misguided farm policy, and weak environmental and public health regulations.
Ultimately, factory farms will only be brought down to cut to size if there is a willing consumer out there saying that I'm looking at my health consciousness, I'm looking at what my product I'm buying, I'm looking at where it's coming from, whether it's being done properly, whether it's a risk. So when we did the survey across 14 countries, including Kenya, and the results are coming, we're just finalizing, it is clear that one, people are beginning to realize the level of awareness of the threat of superbugs is going up because people are seeing the impact. I told you 700,000 people are dying annually because of that problem. And people are seeing their friends going to medical facilities and not being able to be treated. So that's one. Two, people are even beginning to say that we are, one, either going to start reducing our consumption of animal products because there's a problem there. But I also want to say the problem with superbugs is not an animal problem only, because there's work we are now carrying on. We're working around with one of the research institutes here, looking at the environment. Because when you're producing and using antibiotics on your farm, if I use your mother, the droppings from that chicken is being used as manure, which means if there is any antibiotic in that dropping or there is any superbugs in that dropping, it's going into the environment. And so if you're growing plants with that manure, you're already creating a problem because that plant will already have antibiotics, or it will have antibiotic-resistant superbugs, so to speak.
World Animal Protection recommends the ending of factory farming and moving to a more sustainable food system in order to address the current superbug threat and reduce the risk of the next pandemic crisis coming from farm animals. To achieve this, there is need for concerted action from the global retail, finance, and animal production sectors, governments, and intergovernmental organizations to come together to phase out factory farming. Dr. Yamo explains further on some of the environmental effects it has.
Space when you're talking about farming. That's why I said also that we are not exactly where factory farming is. So you need that massive land to grow that animal, which is a challenge. And that is the biggest challenge is, part of that move is moving into natural habitats for wildlife. So it's already bringing a conflict with wildlife, because if you look at this country, where are you going to put big farms? Most likely where, and you're sitting in Nairobi, you hear the debate we have about Nairobi National Park. Why is it there? Why can't we use it for something else? So that's one thing. So you're essentially clearing the natural habitats of wildlife. Wildlife is also critical. That wildlife has a right to the same fundamental freedoms we are talking about. So if you are squeezing them into spaces, what are we doing about what are we doing for the future generation? Will your children's children see a rhino? So you see, it's also impacting on driving other processes around poaching. We are losing natural resources, which has been attracting foreign currency into this country. So that's part of it. The next bit of it, which you've also talked about, is to feed that animal. You need massive farms. So it's not only a farm for the animal, you need an equally large farm for producing feed for that animal. So that's another challenge. Yeah? And then the waste that comes from that animal, and that's why I was talking about the environmental impact. And part of what we are looking at now, the research I've alluded to, will release next year, is about saying, let's go to a pig farm. Let's find out when the pig farmer finally finishes, a big pig farmer or a chicken farmer finally finishes that crop, where does that manure goes? Most likely to the environment. So we are looking at what is in the pig or chicken house. We are then looking at what is in the environment around it. And the biggest one, which I think also one of you journalists must have done, was then that problem where the manure is disposed. If it's next to waterways, it seeps into our waterways. So you're also seeing the problem moving into the water. So you have organisms that are in micro antibiotics in water that then also clears our natural, the ecosystem in that water, but also leads to resistance at that level.
He further adds, stopping this cruel and inefficient system dependent on antibiotic overuse is vital to improve animal welfare and protect animal health, people's health, and ultimately the global economies from the impact of future pandemics. Factory farms place our public health and food supply at risk, pollute the environment and our drinking water, and wreck rural communities while increasing corporate control over our food. We need to change the fundamental structure of our food system. It is estimated that 10 million deaths are expected annually by 2050, with the poorest countries affected disproportionately.